the hip joint is it's a ball and a socket.
Okay.
The socket's part of your pelvis, and it's just like a bowl basically. And around the rim of the socket, around the edge, there's just a rim of tissue around there called a labrum.
Okay.
And if you have a normally shaped socket, then the labrum doesn't really do much in the way of either bearing weight or even containing the ball in the socket. But still, if you tear the labrum, it's painful. So when you bring your knee up and flex your hip or move out to the side, the thigh bone can come up and just repetitively hit and rub on that labrum and put a tear in it. And when you get a torn labrum in there, it's like having a hangnail inside the hip joint for a couple of reasons. One is that it doesn't have to be a big tear to hurt. You just have to have a little piece that'll move a little bit, and get caught, like when you hang a hangnail on a sweater.
Right.
That hurts.
Yes.
The other reason it's like a hangnail is they don't heal back on their own. So if you don't do anything with them, they just keep bothering you. The tears do tend to get bigger with time, and you can get a piece that will kind of start moving around and get itself caught between the bones in there. If that happens, it's like having a piece of gravel inside the hip joint, and it can kind of grind away at your joint cartilage. So it can hurt the joint to have a torn, other than the obvious problem is that it hurts, and it's hard to, get back to your normal activity level. But if the piece starts getting caught, it can start grinding away at your joint cartilage and hurt the hip joint. Your main cushion in there is that articular cartilage. That's that white slick stuff that coats the ends of the bones.
Okay.
And you want to protect that, basically. So now,
deterioration of that would be arthritis?
Yeah.
Okay.
Yeah. And that's one of the reasons I want to see your x-rays, especially the one where you're standing up, because I want to see how much space you show there between the bones to get just a general sense of if you're getting any significant arthritis or not.
Okay.
But I also want to see those x-rays because I want to measure some angles to get a sense of how deep your socket is and how it's shaped. And then I'll look at the upper end of your femur, the thigh bone, because the ball is part of the femur. Some people's bones are shaped such that they're a little more prone to getting torn labrums, and that's what they were talking to you about. Is that you may be showing a little bump on the outside of your femur there,
right?
But also we look at the front part of the femur, both on the X-rays and on the MRI, to see if it's got a prominence there that might be contributing to tearing that labrum or even rubbing away some of your joint cartilage at the edge there. And so if you have that issue as well, we address that as well. So what do you do with a torn labrum? It's pretty unusual for them to tear in such a way that they're fixable, where you can actually fix them back and repair them. It's more common that the tears are kind of irregular and the labrum's a little bit chewed up. So what you do is, like a hangnail, you just trim it away. And you can do that with an arthroscope, little incision, same-day surgery. And at the same time that you're there, you can look at the joint cartilage and see what kind of shape it's in. If you've lost a little joint cartilage right there at the edge where the labrum's torn, you can trim away the loose cartilage there, clean off the bone and burr it a little bit with a burr and try to get you to grow some new cartilage there.
Okay.
Okay. If the upper end of the femur looks like it's an issue and causing some of your tearing, then while we're there, we can take a little high-speed burr and reshape it. That's called femoral osteoplasty. And it doesn't add a whole lot to your surgery, really, but it changes your rehab, because if you work on the femur and take a little of that bone, then you know that you've weakened a little bit in that area until it's had a chance to sort of heal back in and regain its strength. So if you do that, then we ask you to use crutches for about 6 weeks after surgery and put about half your body weight down. Just protect it a little bit and avoid hard twists and falls, because you could theoretically you could break that femur if you put enough force on it, especially that first 6 weeks or so after surgery.
Okay.
And that's really kind of it. It doesn't sound like you had a significant amount of bursitis over here. You were tender, but the injection really didn't make a difference for you.
Mm-hmm.
So probably don't need to talk to you about getting down there with the arthroscope in the bursa area and cleaning that out and loosening this IT band. Doesn't seem to be a big issue.
Okay.
And so that's kind of it. And the The risk of the surgery itself is actually pretty small. The chance of an infection, that'd be a rare event. The big vessels are pretty far away, so the chance of hurting a vessel, that'd be a rare event. The only nerve that you come close to is a little skin nerve that gives you sensation right here on the upper thigh. If you bruise or stretch it, you may have some numbness there for anywhere from a few days or even months maybe, but it's usually not much of an issue. To see in the hip joint, you have to pull on your leg a little bit, which puts pressure up in these areas, and you can wake up numb for a few days. That goes away.
Okay.
That can scare you because you can't feel down there, but that goes away. And anesthesia problems are a rare event. We almost always do general anesthesia, so you're relaxed. Go home quicker that way.
Oh, so I'm not put under. I'm just.
You're put under, yeah. General
Okay.
anesthesia.
Okay. I don't know.
Spinal. The other alternative is spinal, but that has its own risks, and it can take hours to wear off, and your upper body's still uncomfortable, and
Yeah.
it's
Okay.
better to go to sleep. And that's kind of it.
Now, I did watch a video on YouTube of a surgery where they cleaned up the labrum first, and then they put a stitch through it and pulled it together.
And if it looks good enough to do that, you do it.
Okay.
That's not usually the case.
Okay.
It's usually not. It's usually not good to. The tissue's usually just not good enough.
And so in the labrum tissue, it's not that important anyway. It's more of the.
It doesn't do significant weight bearing, like a meniscus and a knee actually does some weight bearing probably, but the labrum doesn't unless you have an unusually shallow socket where there's not much bone up there. Then the labrum's maybe doing a little bit of that work, and that's why I need to see your X-rays and give you a preview of how important that labrum maybe is. But when you've torn them, they're not going to heal, so you deal with them.
That's what the last doctor told me too. I said, "Well, what happens if I don't do anything?" He said, "It gets worse."
Just keeps nagging. Just keeps nagging.